Are the authorities, and I guess that includes you as well, ready to come out and say the Omicron variant is less severe than other variants of the virus? Is that now definitive? Is that science now?
Well, I think there is a lot of data that is piling up to show exactly that the severity of illness caused by Omicron. And the big question here was it intrinsically because of the variant itself being less virulent, or because of the prior immunity or from both vaccination or infection that individuals had that was making this variant, less severe or less pathogenic? And so I think we have more data to now come out and say, yes, this variant is intrinsically less severe. But again, there's a whole process that we have that we need to establish, that this truly is a disease that is causing mild illness across the board, across all ages. And so while there is more and more data piling up, I think it's still too early for us to definitively say, yes, we are certain, because we need to see it play out across all different, age groups, as well as different countries. As you know, here in the U.S., we have a very different population makeup than South Africa. So right now in South Africa, you have seen, the cases may have peaked. Hospitalization and death were very low compared to their Beta and Delta wave. But here in the U.S., we have a much older population. We have more comorbidities. So it may play out very differently here.
So you're the one who raised the question of across the board. And that's sort of my next question here. There are so many different types of people now. You have vaccinated and boosted. You have vaccinated and boosted and previously had COVID, and you have unvaccinated. Are you suggesting that, can you say the Omicron, it looks like at this point, is less severe for all of those types of people, or just the vaccinated?
Yeah, that's an excellent question. And I'm really glad that you broke it down in that way, because that's exactly the information that we need. And we don't have that exact information by age status, by vaccination status, by health status, and then what this means in terms of this variant. We don't have that information, and that's exactly why I had mentioned it's a little bit too early to tell. We have good information piling up for those that have been vaccinated, primarily with the primary series or 2 doses, for example, and what this may mean for the Omicron variant, which we are seeing is much more mild. But we don't know exactly what we're going to be seeing with those that have no dose of a COVID-19 vaccine, not the first, not the second, not a booster dose. They haven't even been infected previously. We do have millions of Americans that still are in that boat, that are both immunologically naive and they haven't gotten vaccinated. So what does that mean for them? How is that going to play out? So again, we need a little bit more information to make some of those definitive, decisions there.
So yesterday I was reading an article about what the CDC is saying here, and they were pointing out that hospitalizations and deaths have not risen, and I think Wilf was talking about this earlier, to the extent that cases have risen. Do you feel comfortable saying that we now have data to say that's the case, or are you still worried about the idea that hospitalization and deaths tend to lag the total number of cases? Is that something that's yet to come?
Well, I think there's a couple of things that I'll mention on that front. First, we know that we are in this for the long haul, and we're going to be living with this virus. And so how can we develop sustainable and flexible guidances and policies, knowing that this virus is going to be around us? But we want to obviously make sure that the end goal here is to save lives and not to have so much morbidity and mortality. And that's exactly what you are seeing with some of these new public health guidances that have come out. So, for example, the reducing of isolation and quarantine time, knowing we're going to be living with this virus. You're also seeing strategies like test to stay in schools. Again, these are all different strategies to show us we can safely live with this virus without causing significant disruptions. And so I think that we are headed down that way as we look at the decoupling of hospitalization and death from cases that is happening. And I actually wrote about that early in the summer, that we're going to eventually see that. We didn't see that necessarily with Delta, but I am confident and I'm hopeful that hopefully we will see that with Omicron. But again, a little bit too early to tell, but I think all the directions right now are pointing us to that way.